Detroit is known to be one of the worst air polluted cities in the country. With factories in production every single day and a population of over 667,000, it's no surprise that the COVID-19 pandemic hit hard. But exactly how big of a role does air pollution play in the pandemic?
There are a variety of particulates, small particles, and gases that exist in polluted air. And these different particles or substances have different effects on the lungs. And we know that they can cause lung damage.
One of the first realizations of air pollution in the US was in 1948, when Donora, Pennsylvania was overcome by a thick smog, causing half the town to experience severe respiratory or cardiovascular problems. And US cities now, with extreme air pollution like Detroit, are experiencing a higher case rate of COVID-19.
There's been a recent study from Harvard where they looked at 98% of the American population, and they were able to associate the risk of death from COVID-19 infection with increased air pollution. So we're learning that air pollution, where it's increased, is associated with increased problems in patients with COVID-19 infection.
And even patients who recover from the virus are not yet out of the dark.
What I'm seeing is that there's a number of patients who have had the COVID infection who weeks or months after having had the infection are still sick. So I'm very concerned about the long-term effects of COVID-19 on people who have had the infection. Most of them seem to be slowly getting better, but the outcomes are not known. So this isn't a trivial infection. This isn't something to play lightly with. Not only can you die, but the people who are getting this are developing longer-term illnesses and having real problems.
And those people aren't getting the attention they need.
It's not just about respiratory illness, it's about any illness almost that you can think of to imagine. And that includes COVID. Here in Detroit, we saw a huge rate of COVID infection among our Black communities and among our poorer communities in the Detroit area compared to the other outlying communities. It has a big effect on our fellow citizens who happen to live in cities, underprivileged areas, or areas where there are healthcare disparities.
How do we solve this problem? Reduce air pollution. The less pollution we see, the better everyone's respiration.
I think for those of us who are advocates for the health of our population, I think we have to advocate for reducing air pollution and trying to improve health. Those of us who can do that, we're more likely to persuade people to do something about this. So don't just accept it, act.